The national health insurance, what does it mean for our people? After speaking about the national health insurance last week, I decided to delve into the aspects of what does it mean really for the civil servants exactly, and naturally the public in general. And a few things are factual. The premiums are going up. The SZV premiums are going up. How much they're going up isn't very clear yet, even though I understood that there's a document out, 200 and something pages. I understood my colleague Ramiko, who does do podcasts, has that document. So I'm going to ask him if I can get a copy and I can look through it and maybe see in there if they have already discussed this law, how much the premiums going to go up. Everyone will have to pay to be insured, and everybody is going to be obligated to be insured in the national health insurance. So we have two things. You have the private sector and you have the civil servantry. Now in the civil servantry, we used to pay 10% of whatever we had spent, and now they changed that we pay 4.75% of our salary towards health insurance as civil servants. When you hear them talk about the copay had to do somewhat with how much they're going to increase the premiums for the civil servants also. And right now I understood it's any place between 0.9 and 1%. So we might go up with 1% in our payments for the, as civil servant, you're going to pay instead of 4.75, maybe 5.75, or maybe even 6, I don't know. The government, who's the employer, will pay the balance. They will pay the balance of whatever the new premium is going to be. For the private sector, their coverage is going to go up a little bit. The ones from the civil servants are not going to go down, I understood. They will remain as is. So the private sector, because of equality, they will have to be brought up a little bit. That means it might be a little more expensive for them and they'll have to pay for it. The law was supposed to go into effect on the 1st of January 2024. I don't know if that's going to be reached because the law has not gone through the cycle yet. It needs to go Council of Advice. When it's finished with the Council of Advice, it still has to go to Parliament for discussion. When it's finished with Parliament, the law still then goes to the government to be presented to the governor. When the governor signs off on it, the ombudsman has 6 weeks to review the law on discrepancies, and when that is finished, you can publish it in the Gazette, and I think after 30 days, the law will go into effect. If you add up all that time, you will realize that you would have passed the 1st of January 2024, meaning that the law will only go into effect soonest the 1st of January 2025. That's what it means right now, in my opinion. I might be wrong, but I don't think I am wrong. But what is worrisome for me is we don't have the information on what these new premiums going to look like and how these new premiums will affect the working class that is already living for 75% below a livable wage. How does this work? I mean, we can't even afford living here now presently the way we should, and we want to now increase the premiums for health care. The burden on the businesses is also going to be very serious because the the healthcare premiums are going up. The sickness and the accident insurance premiums are going up. They're not going to stay the same. They're not going to go down. CFT told us if we don't fix it, the fund will be bankrupt between 8 and 10 years. There will be no healthcare. It is not sustainable. Nor Aruba, nor Curacao, nor St. Maarten is the healthcare sustainable at present. There were reports written of it, so let us not whine about that. That's factual. It means the price is going up. The problem is this: if the prices go up, can we afford it? And if we decide we're going to bring down the healthcare level to make sure we can afford it and pay for it, what level is that going to be then? Is that still within the norms of acceptability within the kingdom? Because that's what we have to look at. We signed on to human rights treaties and all these things, so we got to make sure that we are in adherence of those things. And again, a lot of people don't think on these things. They just blow over them as if it's a God-given. It's not a God-given. If money determines what you're going to get, then we need to know what we're paying for. And at this point in time, I don't know what's really happening. And I get a feeling that we are undermining the sustainability of the healthcare by going to charge people what they can't pay. This copay is very instrumental. And I don't think they're out of the woods yet with the copay when it comes to nor the civil servants, nor the public sector. So it's something to see. But again, I think at the end of the day, how do I say? Let me ask these questions and maybe it will sound better. What does it mean for the people of this country? What does this national health insurance mean for them? Can they truly afford what we're selling as government? If we answer that fairly, with 75% living under the poverty line, under the livable wage, the answer is a resounding no. We cannot move forward the way we are. But again, what does it mean? Because government has this new modus operandus, this wait and see. This is because of a lack of strategic thinking or a helicopter view of what's happening, because it's starting to look scarier and scarier. And this is not fear mongering. This is tell the people the damn truth. Tell them what they're facing. Tell them what they're up against. Give them a fair chance to prepare for it. You all are not even talking about it. You're not bringing out any information to the people. Why? If this was supposed to go in the 1st of January, we were screwed already. Is this the way you all plan to run the government?